Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got 100% on my NPTE, and this led me to co-found SPT with me, which is an NPTE prep platform. If you enjoy what you see and you're trying to study for the NPTE, check us out at sptwithme.com for our prep courses. Now, for what you're actually here for, let's talk about the optic nerve, cranial nerve II. This picture is a view of the brainstem and the thalamus as if you're looking straight on at a person. So we're looking at the front view of it. Take a look at the optic chiasm and look where those nerves are severed, so cut. What you need to imagine is that there's actually a continuation of these nerves that are coming towards you or out of the screen in this case. Our eyes are at the front of the brainstem, right? We're going forward. So we're going from the eyes to the optic chiasm and posteriorly. Something else I want you to note is that the optic nerve does not actually enter the brainstem here. It actually wraps around the brainstem. So normally when we think about cranial nerves, we think about how it enters and exits the brainstem. But in this case, it just doesn't do that. In this image, we are looking at the back side of the brainstem and thalamus, the posterior aspect. So here you can see that the optic nerve wraps around the brainstem and it carries information mostly to the LGN of the thalamus, the lateral nucleus of the thalamus. This is the thalamus, not the brainstem. Now, 10% of the axons do not enter the LGN. Instead, they actually terminate in a place where the brainstem is, the superior colliculus or the pretectal nucleus of the membrane. Now, in this picture, you cannot see these structures. I'll show you in the next image. But just understand that a majority of the nerve goes to the thalamus, not the brainstem. However, again, 10% of it does. This is a lateral view of the brainstem. So you can see how this nerve travels from the tract going around the brainstem. And then, in this image, you can see the superior colliculus. Here's a better view of this tract giving information to the LGN and giving some of the information to the superior colliculus and the pretectal area. There's definitely a lot to talk about with this image, but first I just want to touch on the pathway of this nerve. So first off, the view that we're looking at, it's a transverse cut view. It's a top to bottom view, top down. So you can see that each eye has two sets of nerves, a medial and a lateral tract within each eye. You can also see that there's a lot of crossing over that happens. So do yourself a favor and try to follow the colors along with the tract. In this image, what I want you to do right now is look at the little Mickey Mouse looking configuration. This represents the midbrain. So you'll see in this particular diagram that the tracts are not shown to enter the midbrain because again, only about 10% of them do. I think this image just doesn't show it because it's easier not to. However, now you can see that after they come, the tracts come from the eyeballs, they cross over at the optic chiasm, information is sent to, a majority is sent to the LGN, aka the lateral nucleus in the thalamus, and then information is sent to the visual cortex, which is in the brain, and this is where that information is processed and integrated. Now we're going to come back to this image, but I want to talk a little bit more about some basic things. It should come as no surprise to you, but the optic nerve is a sensory nerve that provides us information about vision. Because it's sensory and not motor, this nerve does not assist with eye movements or pupil size directly. Other nerves do that. Of course, everything works together to react and to respond to what we need to do. However, this nerve in particular is only sensory. So the brain will do whatever it needs to do as a result of what the optic nerve sends to it. So sensory gets sent to the brain, it's going to register and integrate it, then the brain will decide if there needs to be any elicit of a motor contraction. All right, now we're going to go back to this picture and talk about the more complicated stuff. So what this image is trying to demonstrate is all the visual impairments that could potentially occur if there is a problem with the optic nerve. So as you can see, as I've said, each eye has a pair or two tracts. So for example, you look at the left eye and you're going to see that there's a blue and a red tract within just that eye. You look at the blue tract, it's on the left side of the left eye. This side is going to perceive information from the contralateral side. So it's going to see images on the right side. Still talking about the left eye. On the right side of the left eye, the red tract, you see and perceive information from the left side, the contralateral side. It gets a little bit confusing, but just try to use the tracks. Same thing happens with the right eye. When you look at both eyes, you will see that the left portion of each eye, this nerve receives information from the contralateral side, so the right-sided image. The right side of each eye, respectively, will receive contralateral information as well, so the left side of the visual field. So same thing on both eyes. Now, as we make our way from the eyeballs toward the brain, we encounter what's called the optic chiasm. This is a structure where there is just a bunch of crossing over that happens. But ultimately what happens, if you follow the lines, is that you can actually see the blue stays on one side, while the red crosses over to stay on the other side. Obviously, we do not see in blue and red. So the left side of each eye, which receives information from the right side, will go into the left side of our brain. The right side of each eye, which receives information from the left visual field, will enter the optic chiasm and all cross over so that they can give information to the right side of the brain. So with that being said, not everything actually crosses over. As you can see, if we look at the red tracks on the right eye, the visual information that's received from the right side of the right eye, it stays on the right side of the brain. However, on the left eye, the information that's received on the right side of the eye, thus the left visual field of the left eye, actually does cross the optic chiasm so that it can go to the right side of the right brain. This is confusing stuff, right? But it only gets more confusing. Now, after we reach the LGN, so follow your way to the LGN, we end up sending information to the visual cortex that's in the back of the brain through these things called optic radiations. Now, this image that I'm showing you right now, this image in particular, you cannot see the optic radiations. Of course, I'm going to show some images later. However, understand that there is a superior and an inferior optic radiation. So, to wrap everything up, everything so far that we've talked about just has been a left visual field versus right visual field. But once we get a little bit further back there with the optic radiation, we're going to have the idea of putting images into superior visual fields and inferior visual fields as well. So here in this image, the optic radiations are brought to life. Instead of just, a line being depicted as that previous image showed, there's actually some depth into it. And again, like with a lot of things in the brain, it's not just one straight line of a nerve that goes somewhere. A radiation, such as in this case, is suggesting that there's a bunch of different projections going all over the place, kind of like in a fan-like distribution. So, thinking about that, even this image shows that it's still a little bit two-dimensional. So I personally think this is a better image. It's better able to show that there are fibers that are superior and there are fibers that go inferiorly. Now, like I mentioned before, each of these bundles of radiation, so superior versus inferior, they're going to help with giving information not with respect to left and right visual fields, but with respect to superior versus inferior. So seeing things from the top versus seeing things from the bottom of our visual field. Now the radiations on the bottom, aka Meyer's loop, this gives information about the superior field of vision, while the superior radiations give information about the inferior visual field. So kind of just like the rest about what we had talked about from the previous images about how information is, crossed over, it's the opposite in this case as well. So superior gives inferior information, while inferior gives superior information. So I do have a video that goes throughout each scenario, so check that out if you kind of want a guided walk on how these visual impairments occur, but for the sake of this particular video, let's kind of keep it a little more simple. I just want you to understand that depending on where in the tract you see a disruption. So for example, this picture you see where it's labeled number 1. There's a disruption in the optic nerve versus number 3, there's a disruption in the optic chiasma, etc. Wherever there is a disruption along this path, you can determine how that person's vision is going to present. Now, realistically, if you're in a clinic and you don't have any imaging, you have to be able to do the exact opposite of what I'm saying. So you have to test a person's vision. And if there's anything going on with, let's say, either a half of their visual field or a specific quadrant, then you should be able to tell that person or potentially another healthcare provider where in this tract does there seem to be a disruption. And that's exactly where tests come along. So that's what we'll go over now. Let's get into testing. The optic nerve gives us information about visual input. So two things that we can test are our visual acuity, which is the ability of our eyes to be able to distinguish shapes and details of objects at certain distances. So with testing this, that's where the Snellen chart comes in. We're looking at letters. Letters have different shapes. Snellen chart shows different sizes. So we get to see how good or how impaired someone's visual acuity is. Next, we also test peripheral vision. So this is everything that we've talked about for the past few slides, our visual field. Now, the way that you can test peripheral vision is actually by having a person stare straight forward. They could be sitting, they could be standing. They cannot move their eyes at all. And what you're essentially trying to do is see how far to the sides, above and below a person's visual field is to where they can see. So what I mean by this is that, let's say you are staring straight in a car while you're driving. Without even paying attention to the sides, you can potentially see what your passenger is doing. You can see if there's a cyclist that's coming from behind you. They are not, the passenger, cyclist, whatever commotion there is, they're not directly in front of you, but your visual field is so vast that you can actually, to an extent, see almost behind you, right? Now, the standard way to test this out is by having your patient sit in front of you. Remember, it's standard. If you go to the DMV, you're probably standing. It is what it is. But standard is your patient is sitting in front of you, and you're going to start to wiggle your finger in front of them, showing what they should be able to see, right? Something like this. You're going to have them cover one eye. Then you're going to come in from 4 different quadrants. So think upper left, upper right, bottom left, bottom right. You'll tell them to let you know when they start to see your finger wiggling. You're going to come from behind and then move forward. Ideally, visual field should be similar on all 4 quadrants. And if anything, it should be similar to yours. If there is one quadrant or perhaps one side that is lacking, this could suggest that there is a disruption along a part of the tract that we saw in the previous images. And as you can see, there are a lot of potential disruptions that can occur. So if you see that only the left side of the left eye is impaired, you should be able to figure out where exactly this disruption is. Hopefully this made studying the optic nerve a little bit easier, and hopefully it makes more sense. If you enjoy what you saw and you're studying for the NPTE, check out sptwithme.com for our prep courses. Check out these references for more information.